YouTube. Hey. You guys, it's been such a minute since I've been here. This is your girl, Ashley Nicole. I haven't posted a video in a while, and if you're a subscriber, welcome back. But you may know why I have been gone for a little minute. If you're not a subscriber, you can always click the link. I don't know where it'll go, but click the link. And I can kind of tell you why I haven't been making new videos. It's because I had a baby. But with this particular video today, I want to discuss what to expect with a C-section. Before I post this one, you'll probably see my birth story. I got a couple of videos that I've been making. I just haven't had the time to really put them out. Life has been happening. I've got an almost 3-month-old little girl here and 2 other children. So things get a little hectic in this household, but I'm going to start putting them out. So you may see some other videos before you see this one. Doesn't matter. It all is good information for you. So right into it. This was my 3rd C-section. The other 2 children, my first daughter was an emergency C-section, and I tried to do the VBAC with my 2nd child, which is my son. The doctors didn't want to do it because he was too big. I tried to get a VBAC this time with her. The doctor that I had, that's another story, that doctor. She didn't want to do it. She just thought it was a bad idea to even try it, that it was more safe to do the C-section. And if you don't know what a C-section is, it's a cesarean section. And it's just it's a pretty major surgery. It's a major abdominal surgery where they go into the lower abdomen area and pretty much cut you open to pull your child out. Sounds a little crude, but that is what it is, you know. Had to have a 3rd C-section with this little girl. Pretty much had planned it. We knew it was going to happen the first office visit that I had after I gave my medical history. And we scheduled my C-section for May 17th, 2021. So what you should expect when you have a planned C-section. After you get your date, they're going to tell you a few things. Now, some things I didn't get told. I guess maybe they figured I had already had 2 previous C-sections. I should kind of know what to expect. But just in case it's your very first one and you're not sure, not certain what to do, YouTube has a plethora of information, and I'll tell you now. First thing that they're going to tell you, or that they should tell you, is don't eat at least 24 hours, somewhere in that range, before your scheduled surgery. Now, it is crime, it's torture to be pregnant, to be 9, technically 10 months pregnant, and cannot eat, you can't drink, is torture. But it's for a good reason. If you go into surgery and for any reason necessary, you have a medical emergency, and they have to put the tube, I forget exactly what that procedure is called, but if they have to put a tube down your throat, there's a possibility that you could asphyxiate on your own water or bodily fluids, or whatever it is that you put down, you could possibly asphyxiate on it. So they just warn you not to even eat or drink, which is still crazy, but not to eat or drink 24 hours. I think I saw somewhere where somebody said 12. I'm just going to say 24 hours for this video before your procedure. So if you're intermittent faster, you'll be okay. If you're not, just make sure your last meal before that time frame is a good one and will kind of hold you till the next day. So that's the first thing. No eating 24 hours, no eating or drinking. Second thing, now you're having surgery. You want to make sure, you know, you get any of that unnecessary bacteria, anything that's on your skin that could possibly pose a threat to you or your baby, off with a cleanser called HipaCleanse. I'll post a picture somewhere. I'll show you what the bottle looks like. But it's just like an antibacterial soap that you can use all over your body. I focus mainly on, you know, the area that they're going to cut on, but you use it everywhere to cleanse your body and prep of the anticipated operation. So that's the second thing. Now, you've done that for a couple of days. You've not eaten for 24 hours. It's the day of the surgery. You need to make sure, one, you're at the hospital a couple of hours before your surgery time. You want to get there just to make sure you got all your insurance situations taken care of. You checked into your room. They're going to make you come in, take off all your clothes, get into a gown. They're going to go ahead and, you know, suit you on up. They're going to put on your respiratory monitor on your fingertip. They're going to give you your IV so that you can get your fluids in. And you'll sit there in your bed. Your partner, whoever's there with you, you guys will just sit there until your time to go in. Now, usually, I want to say it's 2 hours or so that they ask you to be there at the hospital. My surgery was set for 11. We got there at like 9 something in the morning and just kind of hung out until it was time. Now, one thing you should be prepared for, because it happened to me, is be prepared for your surgery time to be pushed back. I was supposed to go in at 11 and we didn't go in until 2 something. And that's because there are people who have emergency needs for C-section. I don't know if I meant to say it that way, but people who have emergency C-sections that need to happen. Sorry, y'all, my dog's out there losing their mind. Other people may have a need to go in before you, and that was my case with my first child, so I understood. So do not be surprised if you get pushed back for somebody else who needs that time slot before you. So I got pushed back for at least 2 other people's procedures. Fine, whatever. It's just, it kind of sucks when you have a planned C-section and you have it set in your mind you're going to go back there at a certain time because your nerves are like kicking. You know, it's still a major surgery. Even though it had happened before, I still was very nervous. So to keep getting pushed back just made it worse. And it's finally time for us to go back. They will roll you over to the OR, which is sometimes right across the hall. My first child, it was right across the hall, and the doors just open up and it's like this sterile white room. It's freezing cold in there. Be prepared for it to be freezing cold. Not sure why it needs to be cold in there. Maybe something about the body or the equipment they use. I'm not sure. The OR is freezing when you first go in there. But they will take you in there and you will hop up onto a table that is a slim little slab with little arms out. It looks like the cross that Jesus was crucified on. It's crazy. It's very nerve-wracking when you first see it. But they ask you to step up there and then they hoist you up. This is the time frame where you'll be by yourself. Your partner will not be with you because they're going to give you your epidural. Now, you get the epidural, or it's a drip, or something else. I cannot remember the exact names, but there's 2 types. And I got the one where it only lasts for a couple of hours. So I got that put in there. What they're gonna ask you to do is to hunch over because you have to open up the spaces between your spinal cord, because that's where they're gonna put it. They're taking a huge needle and they're putting it through a small space in your spine to numb the lower half of your body. Actually, there's a needle they give you first that they pinch you with to numb the area before they actually take the epidural. So be prepared for that. You'll have a pinch and then the actual needle. And slowly you'll feel yourself. You'll feel yourself getting numb, and then your legs get heavy and they ask you to lay down on the table. You'll spread your arms out like this, and that is when they're gonna insert a catheter. Yes, you're gonna need a catheter because you won't be able to walk. The epidural is not gonna wear off right away. So might as well get it in now. They'll slide an epidural up there. They'll slide a catheter up there, and then it's time to get ready. Once all of that is done, then your partner will come in. My husband came in. What you can also expect is to have a team of medical professionals in there. There were 2 doctors. There is the anesthesia, what do they call him? He's not a nurse, it's the actual doctor who, like, I don't know what his official title is, but there's the guy or woman who's handling your anesthesia, who's administering it, and then there's other nurses and a whole crew of surgical techs and everything around you. To be happy in my case, all the doctors in the room, except one, were Black women. So shout out to us. Hey. Okay, back to the story. So expect that to be several doctors down there actually working to get through and get to the baby. There's going to be a nurse or a doctor next to your head administering the anesthesia, and your partner will be on the other side. Now, hopefully you're in a facility that will allow you to have a camera in there. He was able to have his camera in there. He recorded the whole experience for us. It was really cool. And in this particular hospital, the doctor even told us we could have brought in like a speaker, have a playlist, so we could kind of just relax and have some music to kind of take away from the fact that you're in a major surgery that you're awake for. But those are some of the other things that you could possibly expect. Just depends on your hospital. Ask before you go in, because some may not want you to have cameras in there, and they may not let you have music. This particular doctor, she was cool about that. I will give her that. She encouraged us to bring music in there. She said she wanted to have a party. Doing deep surgery like that, I don't want you to have a party. I want you to be focused. But it just was a way to make me, I guess, feel more comfortable. Once you have gotten cut into, you're going to feel a lot of tugging. Be prepared for that. You will not feel pain. You should not feel sharpness or pain, but you will feel tugging. So be prepared in your mind to be kind of jostled around as they're tearing through layers of muscle, fat, and whatever else to get to the child. So do be prepared for that. If you've had multiple C-sections, well, I guess if it's your first one, you won't have the situation. But for me, since it was my 3rd C-section, there was scar tissue that they had to get through, so it was a little bit more. But Once they get through all of that, once they get through the layers of muscle and they get to the uterus, they'll cut that open, pull out your baby, and you'll hear the joyous noise of babies crying, right? They will whisk her over to the him or her over to the warming table. You'll probably see that on the side of your head. They'll clean her up, him or her up. They'll get all of that out, show you the baby. Hey, mom, here's baby. Some places they will go ahead and put the baby close to you so you get skin to skin instantly. Me, unfortunately, they did not do that, but they did let my husband, he got to get close with her. They cleaned her up really good. And I'm saying all of this is this going on. My surgery took like maybe 20 minutes or less. It was very quick. Depends on your doctor how fast it'll go, but it's not that long of a procedure. I read at first 45 minutes. Mine's 20 minutes or less, but just depends on your doctor. But while you're looking at baby, they'll continue to be working on you because they have to get out the placenta, they have to clean all of that out, and then they have to sew you back up. And then it's time to go back to your room. So the surgery's over, the baby, sometimes they'll give you the baby to hold. I think I held my daughter when we rolled back from the OR to the recovery room, which is the room that you first check into. Now, normally in the recovery room, you'll sit there for maybe an hour or two, and this is where the nurses are just gonna monitor your vitals, make sure everything's good, your blood pressure's okay, there's no complications from the surgery. If everything goes good, in my particular situation, there was an issue, but I'll explain that in another video. But if it's uncomplicated, they will go ahead, give you your baby. You'll be very tired. You'll be very tired. They'll encourage skin-to-skin contact. They'll encourage breastfeeding if possible. Now, my daughter came out the womb looking for a nipple, so she tried to feed on my husband. So that's what we did. When she came out, they gave her to me, put her on my chest, and she went to town. So that's gonna be something that happens for you, but do realize you'll be extremely tired. You just had major surgery and you just had a lot of drugs. So as that's wearing off, you'll be tired. Get your rest because they're not gonna let you rest that well. First off, everybody who knows you've been in the hospital, you don't get to rest that well because people constantly come in. But try your best after the surgery to get as much rest as you can because there's another part. It's not over. Oh, it's not over. Expect to get assaulted for the next couple of hours because now they have to make sure your uterus goes down. So expect those, I think they call abdominal massages. Expect that. And those are painful, right? Yeah, you're still kind of letting the anesthesia wear off. So you're not really able to get up the first day or the first couple of hours after the surgery. I think the first day you can't get up. But they're going to come in and they're going to massage and like knead your stomach to get your uterus to make sure it goes down just so there's no issues. Painful, 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 painful. But it's just something that needs to be done. Second day after surgery, when you wake up, they're going to encourage you to get up. You are going to walk, which is kind of, in my mind, a little barbaric. You just had a serious abdominal surgery. You need your abs to kind of get up and move and walk. And they're pushing you to walk. I would think, let me rest more. But I'm sure there's a reason. They maybe want to prevent blood clots. I'm not 100% sure why they make you get up so soon, but they're gonna make you walk the next day. Take your time, ask for help. They're gonna the nurses will definitely be there for you, but if you've got a partner there, ask for help. When you've gotta go to the bathroom, you gotta go to the bathroom and you're gonna have to make sure you don't fall. You're gonna have to make sure you just support all of your abdominal area. It's gonna be tough. And that's pretty much it. They'll release you when they think everything is good. You'll go home. People spend maybe a day to 3 days in the hospital. I was told possibly 2, but I had other issues. So I had a couple of key tips. I'm trying to wrap this up because I didn't want this to be that long of a video. When you go home, just, you know, like I said, ask for help. Make sure somebody's there to help you with baby and to help you with yourself because now you have to care for this little one and recover from a major surgery. Just be mindful that you will need some things from the store, something maybe to rinse yourself to kind of clean up that area. You'll still have to get rid of the excess blood in your body, so you'll be bleeding for a while. Make sure you have like pillows to support your back, pillows to support your front, especially when you have to go to the bathroom. Be prepared for constipation. That's definitely going to happen after your C-section. All the medicine that they gave you during and after to deal with the pain, it's going to possibly block you up. So be sure that you get something to help you with the constipation. Take the pain meds that they give you. Do not try to be a superhero. Take those pain meds. That's going to definitely help you out with your healing because if you're sitting there and, oh, I can take it, and then you let it get to a certain point and the medicine is not going to help you as quickly, that's kind of your own fault. So take the medicine that they give you for pain or whatever they recommend. And yeah, just enjoy your new baby. I'm sure there are things that I have missed. Everybody's experience is different with their C-section. I just felt like this was a video that I could put out for you guys since I'm kind of an expert on it. 3 of them. Hey, no, actually there's people I've seen on this platform that have had like 8 C-sections. Bananas. But that's just my experience, kind of what I think you can expect. If you are here and you're open to commenting, comment down below on what you may experience or other things that new moms or moms who are having their first C-section can expect, or even just for their partners so they can know how they can be a little bit of help to the mother-to-be. Again, thank you so much for watching, guys. I'm going to continue to put out more and more content for you. So excited to be back and getting back on the ball of making videos. I've got 150 subscribers, guys. I know that's nothing, but that's something to me. So go ahead. Again, I'm going to push it. Subscribe or wherever it may be. And click on the notification bell because I'll post more. And wouldn't you like to know when I post it? Wouldn't you like to know? But again, thank you for watching. If you watched all of this, congratulations. If you're having a baby, congratulations. And I will see you guys next time. Thank you so much for watching and you have a great day.